Dr. Rouse here, Open Late Dentistry and Orthodontics. If you are seeing this video, it's probably because you got a tooth removed or extracted. I wanted to go over a couple of the do's and don'ts with you myself. The dental assistant probably said a few of these anyway to you, but it never hurts to hear it more than once, right? The main things that you don't want to do after you get a tooth removed would be smoking, drinking, or using a straw. And that's because we want you to form a clot, and then the clot basically fills in the hole, and then your gums grow over the top of it. So we're trying to get that done as quick as possible. If we put a dry socket barrier in, or if we added bone graft material or anything like that, it's also because we're trying to speed that process up and make sure you have the most bone for a future implant, or so that you don't have paresthesia where you cannot feel your face, when you're touching it. So that happens a lot of times after wisdom teeth, especially lower wisdom teeth. So if you just got a tooth removed, and let's say it's a front tooth or one of these side teeth like a premolar, we most likely didn't do any of that grafting, but we still want you to stick with the rules, which are the no eating through a straw, no smoking, no drinking, alcohol, that is. You can, and that's for a few days. If you're smoking, ideally we'd like for you to stop altogether, but if cessation is not possible, then at least for a few days, please do that, because we just don't want you to get a dry socket. That would be pain that radiates to the ear. If you feel like you have pain that radiates to the ear, you really need to give us a call and come back in. I have taken out so many teeth and sort of come up with a way to help prevent dry socket that I think really works. I have very few times now, with all the times that I've taken out wisdom teeth, that people have come back. So I'm really proud of that record. But the main things for pain management when people do call and they'll still have swelling or pain is we can call you in an antibiotic if we need to. We are more than happy to call you in a steroid pack if you get that, the chubby cheeks like I'm sure you've seen on a lot of high schoolers when they get their wisdom teeth out. And I do that quite regularly before we even do the procedure. We do a prescription for a nausea. If you experience a lot of bleeding, some people bleed a lot, some people don't. If you're swallowing blood, or you feel like you get to a place where you're just nauseous from the surgery, please give us a call and we can call you in something for that. I usually recommend with anything dental related, if you're going to take a NSAID like Motrin, Advil, anything like that, you need to take at least 3 tablets. So that's 600 milligrams. And because 2 is typically not going to do anything. And for the first 24 hours, for the first day, if you want to alternate and take something every 2 hours, you can take Tylenol, and then 2 hours later take some Advil, then 2 hours later take some Tylenol. So you're going back and forth, but you're always staying ahead of the pain. That's really important. Stay ahead of the pain, guys. And if you have any questions, please give us a call, 972-885-9670. Really glad that you got that tooth taken out. I love when patients are proactive and make sure to get infection or teeth that are broken out as soon as possible. And we are definitely here for you. Don't feel like you're going through this post-op process after the extraction by yourself. We're here for you. So take care, and feel free to give us a call, or you can reach out to us via email. If you send a text message to that phone number, 972-885-9670, a lot of times I'll be able to see that as well. So if this is on the weekends, please feel free to text, and I will probably text you back. Most likely I'm with my kids. So anyway, hope you guys take care, and we will see you again soon. Thanks for being our patient. Bye-bye.